So the group started about 12 years ago. It was started by Leandri, and she realized that there was no support for ladies with PCOS and endometriosis. So she started up the group. I came along. I've been part of the group not long after that, and we have about 11,000 members across South Africa, all of whom have PCOS or endometriosis. From a support point of view, we each have our own experiences, and by sharing those experiences, maybe there's somebody else who's afraid to ask about their symptoms that can take from the shared experience to what they are suffering and put it into use in their lives, what the person has done to alleviate their symptoms. The woman thinks their bodies are failing them, but they don't realize that there is a way to get help. Not just you live your life and your body's failing you and you need to accept that.
There's also a lot of community, online communities where women are also sharing their lived experiences about either endometriosis or even infertility. And then you see that a lot of women actually adopt someone else's story or somebody else's narrative and make it their own. And that already takes away from the individuated nature of your diagnosis. It also takes away from possible intervention strategies that could have been beneficial to you. What could have been beneficial to you might not have been beneficial to someone else. So it actually limits your intervention strategies going forward and the kind of help that you will seek. Somebody might say, therapy never worked for me. And then you would then conclude that, okay, I'm not going to go to therapy because this person said it never worked for them. But chances are therapy might work for you if you have, comorbid psychiatric conditions that are associated with endometriosis. So to be very careful not to overgeneralize the condition and to also just absorb either negative or even sometimes positive information that's not necessarily related to you.
Imagine someone telling you can't have children, you shouldn't have children. But that is the one, for some women, that is their main purpose in life, is to have children. And they want to have these kids, but they're being told that they can't.
The one day we went to a baptism together, and it was in the thick of our treatment. We just felt so left out, and so we're like, what are we going to do if this is our lives? We couldn't decide what we were going to do at the time, but it was just, I can't explain the feeling. It was just that instance alone, it was just so scary, because now obviously my plan was to have kids all along. So to think of a life, I almost had to mourn that life. Obviously it turned out fine, but it was I don't have the right words for it, very scary, very unknown.
A large part of what we see in the group is that they're not getting the support they need from their husbands, be it emotional support, medical, financial support. They're not getting that from their husbands. There are women that can spend thousands to get themselves right, but it's their husbands that they need the support from that they're not getting the support from. I think they need to find out more about their wife's medical history. A lot of men turn a blind eye to it. They're like, okay, no, that's my wife, that's her body, she needs to deal with it. But as men, they need to find out why your wife is behaving like this, what is happening with her body, what is she going through? Because a lot of men don't understand that. And by understanding that, they'll understand what their wives are going through, and they could support them better.
So practical ways in which partners can support their significant others is really come for the consultations. Come for the consultations. And I'm really saying that because I realized someone around you, whether it's your friend or your sister or your mother, come for the consultations, because then you get to ask questions that you're not sure of, that they may not be able to answer themselves.
So husbands and partners obviously do play a vital role in supporting their partners that are struggling with endometriosis. But I always express that in order to be able to take care of somebody else, you have to be able to take care of yourself. So I would also promote self-care for them, and self-care can start with therapy. Usually because the diagnosis is on the woman would show up for therapy alone. And then I would encourage to say, invite your partner so that we can get his lived experience.
the guys also have questions. You know, they also need to be heard. So, and especially if you're in a relationship, it's just a lot easier. And then that support will be more organic than, I still don't understand what's going on, but I clearly, you know, I need to support you in some way. But once they have that clear understanding, it's so much easier.
One of the main strategies or main skills that I usually emphasize is to listen and validate. So you might not be experiencing the pain, but validation goes a long way. And being able to actually actively listen without intending to respond also actually improves the communication between the couples. You know, husbands can or partners can also educate themselves about the diagnosis. And this education obviously begins in the doctor's room.
Partners, not just husbands, partners, husbands, men, support, educate, hold hands. If you know your partner's go to the gynae with her, make it a day trip and go with and find out more about it. Especially, I mean, going to the beginning, if she's complaining in bed with you, then go with her and find out why. Be more understanding. Look, I must say I haven't struggled with that. I think a lot of men are becoming a bit more understanding. I mean, I've had a few ask me about IVF, even from like groups and that, obviously being supportive partners. So I do think it is turning, but I do think go with your partner or friend, or listen, just don't make it a joke. That's all. Don't joke about it.
A lot of women have actually expressed a reluctance to engage in romantic relationships because they wouldn't be able to, you know, fulfill some of the functions required in a romantic relationship. So the painful sex is usually, again, minimized by their partners, especially if they don't have insight about the diagnosis and what to expect. So if it's minimized, then it comes across as though you are withholding sex. So that causes a lot of strain in that relationship and can cause a lot of conflict in romantic relationships, or even in marriages where now the marriage is at risk because there is no intimacy in the marriage. And that causes a lot of frustration for both partners. And a lot of the time I've seen women, the best way they can navigate it is to avoid sexual intercourse. And that is not necessarily effective, but it comes across as the best way in the here and now. It's all I know because I'm in pain. But when you see the change that comes with having consulted with a medical professional, managing the pain well, and also through psychotherapeutic techniques, being able to actually start engaging not only with your partner, but the relationship that you have with your own body. The importance of sexual pleasure for yourself as well, because then sexual intercourse becomes a dread. It becomes an anxiety-filled experience as opposed to something that is enjoyable for both partners. So having to reestablish that relationship with your body, but also relationship with your sexual self, and how to get into, you know, enjoying sex once again, or sexual intercourse once again, and being confident to actually initiate without the anticipated pain.
A lot of the men, the reaction has been, we didn't know that was happening. We don't understand it. We're men, we don't have those body parts, we don't understand it. And now that we've educated them about it, they've been more understanding of their wives. The one woman was ready to file for divorce. She was like, I'm done with this man, he doesn't understand me. And I actually had like a 3-hour conversation with him the one day. And he went back and he said to his wife, I'm really sorry, I didn't understand what you were going through. And now that I know, how can I help you? How can I help support you to be better? And that changed their marriage around.
I think the kind of role that primary support structures can play in supporting women that are struggling with endometriosis. One, we would look at firstly the interest in trying to understand the diagnosis. So accompanying them to their checkups or their consultations with their doctors. That also puts you as a primary support structure in the presence of a doctor that can also explain to you what the condition is about and can also explain your role. A lot of it, yes, you cannot take away the pain, but your presence and understanding, as well as a lot of empathy that you afford the patient, can really go a long way. Opening communication channels as well, where a patient is able to express their needs, express their frustration without feeling judged or without feeling like their symptoms or their lived experience is somewhat, minimized. So that would be educating yourself about the condition so that you know how to best support the person, and then also being open to communicating about the diagnosis, the impact on their lives, but also understanding that yes, the diagnosis might be a universal thing. We all diagnose with endometriosis, but how it impacts on us and how we emotionally respond to it can be very different.
The support structure has been incredible. I mean, I think my family and my boyfriend have probably been the best support structures. With my dad and my brother, for example, to speak about them, my dad has obviously gone through a lot of it with my mom, with being with my mom, and then with having my sister and I and us growing up and stuff, and then with my brother, he's also seen how we've struggled in our lives, so they've been very sympathetic and empathetic, which I really appreciate. Sorry, I'm trying to fight back these tears. The support structure has been incredible. I mean, with my mom and my sister, with them having gone through their own problems, they are able to relate more to the struggle. And yeah, my mom has gone with me to nearly every appointment. She's always been there. Sorry. My family always makes me emotional. She sat there at every hospital visit, always there. My whole family was always there. I mean, my dad runs his own business, so he would be working and stuff, which is understandable. I don't expect them to sit there while I'm having an operation. But, they've always been there. And then when I've been at home, it's always been a very comforting and loving support around you when you're recovering. And that's exactly what you need, and they always try to understand what you're going through and what you're dealing with. And, when the doctors say this and that, then they're also asking questions, okay, so that they can understand better, so they know how to support you more. So yeah, the support structure has been incredible in my life, with my family, with my boyfriend, with my friends. It's all of them have been very supportive and very understanding about it.
If you know someone with a diagnosis, especially if it's a daughter or a friend, maybe we've got so much now compared to when I was younger. You've got TikTok that can educate you on this stuff, which I know it sounds crazy. Instagram, just type in there and just get a bit more education about it. Oh, she's not being dramatic, she really is in that much pain, or it really can cause so many issues. So it's a hard thing because you can't force people to do anything, but I do think educate yourself a bit more about it.
Looking at parents that are helping their daughters navigate the physical impact of painful periods. It's something that you mentioned earlier, was that encouraging their daughters to consult with a gynecologist from the time that they start their first period. That would also allow for earlier intervention. As I previously mentioned, that some of the women that I've come across would actually express, late diagnosis of the condition and express such a major loss of function because the intervention wasn't there when the period started. it's usually interpreted as what is expected. If you're on your period, you should be in pain. But the severity of the pain can only be diagnosed, obviously, by a medical professional. So encouraging parents to actually start to talk about menstrual health, not just explaining how to use sanitary pads and how to dispose of sanitary pads, but what does menstrual health mean? Such conditions were never spoken about when we were in school. I mean, I'm not even that old, but we never spoke about fertility health. We just spoke about period care, but never fertility health. So when we start having such conversations, we actually encourage also consultations with gynecologists for women at a very early age, and it also takes away the discomfort or the embarrassment attached with having to consult with the gynecologist. It normalizes it.
If you do have a daughter, like I said, from day one, sort it out, take them to a gynecologist, have them seen by a therapist, just don't let them feel unheard.
Listen to your daughters, take note of the symptoms and take what they're saying to you seriously. Go help them in terms of seeking advice from medical professionals, and take it further. Even if it means getting 5 different opinions, do it, because there might be 4 doctors telling you that there's nothing wrong, but there might be one who will truly listen to what you're saying and will help you.
My advice to someone struggling, 23, and I've told everyone that has started, I'm like, if you sense there's a problem, have it sorted out straight away. Don't wait, because you advised, because of that young age, you're advised to wait a year or so long or longer before you seek treatment. No, if you feel like there's a problem, go straight away to the doctor and because in my experience, other than the one gynecologist, I felt very dismissed. So find someone else or get it sorted straight away. You're never too young. Never too young.
If I could tell my younger self anything now, it would just be to stay strong, to not feel so defeated, and that everything will be okay, that we will get through it and everything will be okay.